special focus on your health for the next 20 minutes or so. Cervical cancer is what we're going to be talking about. And I'm joined in studio by Benda Kithaka, who's chairperson of Women for Cancer. And also we have chairman, Kenya Network of Cancer Organizations, David Makumi, with us in studio. Thank you both for coming in. Good morning.
Good morning.
Let's start with you, Benda. Talk to us about Women for Cancer, what that organization does before we go to cervical cancer.
Okay, Women for Cancer is an advocacy organization that deals with cervical cancer detection, treatment, as well as prevention.
Okay.
We look at letting every woman know that cervical cancer is detectable, early detectable, and also easily treatable if detected early.
Detected early.
Yes.
What is, when talking about cervical cancer, and I know you're a man talking about this, but an understanding of what causes it?
Yes, it's important actually for men to have this conversation.
Sure.
Actually, that is what will help us turn the tide against cervical cancer. It's one of the reproductive tract cancers that affect women, and actually the second most common cancers in women in Kenya, but the leading cause of cancer deaths. It affects the cervix and can obviously, like all cancers, do spread to the surrounding organs and to other parts of the body. And like Benda has said, it's one of the most easy to detect and easy to treat.
Yeah.
Okay.
Yes.
So how detection, what does it manifest as? How is it easy to detect?
The thing about cervical cancer is it's not, you can't say that there are signs and symptoms that you'll see when it's not yet cancer. And therefore, you cannot say that early signs and symptoms. What we say is it takes time to develop, over 10 years actually. Before with cervical cancer, it's called precancer, where we're talking about HPV infection, and then gradually grows into invasive cancer. So what we're looking for in early detection is to be able to capture the precancers before they become actual invasive cancer.
Yeah.
That way it's treatable.
It's treatable.
Because when we go to the signs and symptoms of cervical cancer, where we're talking about vaginal bleeding, where we're talking about pain during sexual intercourse, or even foul-smelling discharge, at that time it's already invasive cancer. And at that time we're saying that the benefits you would have had in early detection, you've already negated them.
Okay.
So when we talk about cervical cancer, and that's what we talk about to women and even men, to let them know that the benefits are get yourself checked early, and for this you're doing an annual screening using the PAP kit, so that then when you get that done, you're able to detect the changes in the cervical cancer cells as early as possible, when your treatment options are very open, when your treatment costs would be very minimal, and again, the kind of recovery that we're talking about is actually 100% treatable if discovered early.
What causes it? What causes cervical cancer?
Majority of cervical cancer that we see in our country, like in most developing countries, are caused by the infection with the human papillomavirus. There are many subtypes of papillomaviruses, but there are specific ones, that are subtype 16 and 18 and 33, that actually are responsible for majority of the cervical cancers. Having said that, there are actually a small percentage of women who will still have cervical cancer even if they didn't have the human papillomavirus. The human papillomavirus is sexually transmitted. So that's a very important piece of information when it comes to prevention, because then it follows that in terms of risk factors, the more sex partners one has, the more likely that they'll get infection with the human papillomavirus. And once women have that infection, between the time they get the infection and when they actually develop the cancer, it may be anything from 8 to even 15 years. And that is why we have a golden opportunity to actually detect those changes. And the other good news is that the fact that we can also do HPV testing to know that whether one is actually infected. They say HPV. That's the human papillomavirus. The virus that is responsible for majority. It's actually, you can do a test, a DNA testing to know that whether one is infected or not. And the other good news is the fact that we also do have vaccines against that particular virus that is responsible for majority of the cervical cancers. So having said that, of course, there are risk factors associated.
What are they?
The risk factors that are associated are, of course, a higher number of sexual partners is a major risk factor. We also know that in our country that the sexual debut in young girls is much younger. Majority have the first debut from the age of 10. So having started so early, then they are more likely to be infected with the human papilloma virus. There are also other lifestyle risk factors like smoking, we know is a risk factor, not just for the ones with no lungs and so forth, but it's also a risk factor for cervical cancer as well. Yeah, so those are major risk factors. Of the risk factors.
Yes. To add on to that, Sophie, we also have, for women who have had many children, that also predisposes them to having cervical cancer.
Why?
Well, scientifically speaking, and this for me, coming from an non-medical perspective, it's the more you're having babies, probably the more the cells are in abrasion, probably, so therefore more risk of the infection getting invasive. But not even talking about that, look at it this way, Sophie. In Africa, we have more children than in the West. In Africa, we don't have as much screening done as in the West. In Kenya, for example, you will have 1 in every 10 women screened for cervical cancer, and that is voluntarily. Awareness levels as well, that this is actually detectable, is lacking. Many people, even in Nairobi where we are at, where all the services for cancer treatment, majority of the services for cancer treatment are, people don't go for screening. And yet David is saying 8 to 15 years for cervical cancer to develop. What are we waiting for? Early detection saves lives. Let people take their lives in control and make sure that they're taking this conversation to even their sisters, their cousins, their husbands, because you've had, it's a sexually transmitted virus. So the husband needs to know that this is a conversation you need to be having with your wife as well. How often is she being screened? If not screened, if someone is having more than one sex partner, then make sure that you also have this conversation about screening. Because what we're saying is, granted, people will have babies, granted, people will have sexual relations, but take care of yourself. Get screened early. That's a conversation you need to be having.
I like what you're saying, because it's about women and men, I guess, taking charge of their lives. I mean, that is a long period of time to then get into that phase where you're calling the invasion cancer. Because then at that point you say there's nothing much that can be done.
Much can be done in terms of control and treatment and management of the cancer. And actually, cancer is staged from stage 0, all the way to stage 4. A lot can happen between stage 0 all the way to stage 1B, where we're saying treatment is actually can even give you better chances of recovery and also not having so much done in terms of the hysterectomy, losing all your reproductive organs. But stage 2 to 4, again, there is treatment, management, and the medical field, a lot of advances have been done in that. But why wait for when you have to pay more than 40,000 shillings? A hysterectomy right now costs the common mwananchi between 40,000 and 200,000, depending on where it is that you're going. Why wait when you could have had a cryotherapy, for example,
and you need
for
to break down those terms as you say them, what they mean.
The thing essentially is, if you detect cervical cancer early, you don't need aggressive, expensive treatments, whether they are surgery, whether it's radiotherapy or chemotherapy. It's actually cheaper that way. And as a country, if we are looking at investing in reducing the number of women dying from cervical cancer, then we need to invest a great deal in health promotion and also in preventive initiatives and screening, because it's much cheaper that way. You don't need surgeons and other specialists.
So let's talk about screening. So what does one do? How does it work, this whole screening?
Okay, speaking from a perspective of Women for Cancer and what we have been doing is, one, we need to create a lot of awareness. Awareness is somebody needs to know why the benefits of early detection, so that they seek it out. Even gynecologists, even the clinics where people go for other treatments, you'll be able to access your PAP test.
So it's just PAP that's used for screening?
PAP is one of them.
It's just one of the modalities.
There are other modalities, like, for example, here in low resource settings, VIA VILI, which is visual inspection using acetic acid, and which is what the government has been promoting in the healthcare facilities, is accessible to women. But women don't know about it. So they don't know that you can go to your clinic and request to be given a cervical cancer screening using VIA.
So the first step is that awareness.
Awareness.
Just know.
Yes.
Knowing that there is that time and room, and it's important for it to be caught early. That it is easy to.
Yes.
You talked about PAPs. The others, which are the others?
Actually, Pap smear is only one of them. It's been used for many years around the world. It's the gold standard around the world for more than 50 years. But given that it also needs, specialists who will have to read the slides and so forth, in the last few years we have that visual inspection using acetic acid, which is basically vinegar, which is table vinegar, cheap modality, can be done at dispensary level. Doesn't need any specialized, equipments and so forth. You only need trained nurses who are able to actually visualize the cervix, paint it with acetic acid or iodine, that's vinegar. And if there are changes that need treatment, they're able to offer some treatment right there at the facility. A cheap modality that will cost less than 100 shilling, the actual cost. And the government is trying to avail that. What we don't have at this moment is a national rollout program that says, every health facility, you walk in there, you will get it. And given that now we are into devolution and all this county business, then at our county level, if our people are empowered at the grassroots to demand this from their county health executives, that our county hospital or every county should have a number of health facilities that are able to do the visual inspection using acetic acid. Remember that for screening, you don't have to have symptoms, you don't have to be sick. Screening simply means we are trying to find the disease before it happens. You don't otherwise. So
you don't need to be feeling any pain when passing.
You just
having sexual intercourse. You shouldn't wait for that.
You shouldn't. You should
just
actually
now, today, you can
go today. And the other thing is, it's annually. If you're testing and it's negative, you can do this every year.
I was going to ask you,
and then you skip. If you've done 3 tests and it's negative, the World Health Organization advocates for even you going every 5 years after that, because your chances of getting it are much more reduced. Therefore, people need to know after your 3rd test, for example, if I take the PAP test, you can go on alternate, you can skip, but don't wait until you have the signs and symptoms so that then you start saying, oh, I need to go and see my gynae. And Sophie, speaking about the low resource setting in terms of VIA, and speaking about the PAP test, I want to tell women out there, you have options. There are those ones who can afford it, and therefore they can go to their gynae and request for a PAP test. But women need to learn to start asking. Because what happens is you'll go to the hospital, chances are you've been told you need a chest x-ray or you need to do some other test. Why not couple it up with a PAP test? Because it could be the difference between your life today and 10 years from now. And the other thing is, Sophie, as long as we're having this conversation, women also need to know, unless we're demanding for it, what David is talking about is devolution. It won't happen as soon as we would want it to happen. Because if you go asking in every clinic today, if every woman, every mother in the village, every girl in the village was asking for this, chances are our government will also give that facility to the people. But right now, we have very many health priorities, including the pay for the healthcare workers. We have to think about prioritizing. Cervical cancer is one of those priorities.
At what age do girls start going for this test, the screening?
Ideally, they should go 3 years after the first sex debut. You might find some literature saying from the age of 21 and so on, but the easier rule to follow is that, given that they start getting exposed to this virus much younger. So if they started their first sex debut at the age of 12, then at the age of 15 they should actually do a VIA, that visual inspection test, just a cervical cancer screening test. They don't have to worry about who is it, PAP or VIA, all those terminologies. Simply just walk and have a cervical cancer screening test. These days we are talking a great deal about integrating screening, so that we are not just worrying about the cervical cancer piece yet you are the same woman who needs to be taught a little about how to examine your breasts. So that should also be incorporated. So it's integrated kind of program. We need to tell you, if you're a smoker, you need to stop smoking. If you have a problem with weight, you are obese, then we need to talk to you about lifestyle factors. So we are looking at you in terms of the whole cancer risk reduction program. So then we do the cervical piece and ask you a couple of questions that will ensure that you don't come back again. And that can be done anywhere. We have a lot of missed opportunities in our healthcare facilities. Chances are a mama has taken a baby to a clinic. Today, thousands of women will take their babies for vaccination, for chanjo. But we will probably have chanjo being given, the vaccine, but nobody will ask the mama, and are you screened? Yet they're in the health facility. So there is need to integrate these programs and not let people just go away. Yes.
Benda, when this tests are being conducted, you've talked about the period being 8 years too?
Yeah, to 15 years.
That means that it's older women then that get affected?
Not necessarily.
No, in terms of now getting the cancer, you see it manifesting later on.
Consider this. He talked about the sexual debut at the age of 10, at the age of 14. We're saying if it's 8 years, and if you've been infected with HPV, and then reinfection happens and continuously, we're talking about a number of years, 8 years. At the age of 24, you could be a risk, a cancer case, if your HPV didn't clear. Now, Sophie, I want to make women understand as well. We're not saying that everybody who gets HPV gets cervical cancer. What we're saying is 90%, 99% of cervical cancers have been proven to have originated from HPV infection. The difference, therefore, is getting screened as early as possible will mean that you're getting it sorted as early as possible. If, on the other hand, if you look at now HPV infection, there are quite a number of strains of HPV. He talked about 16 and 18 as the strains that would be considered to be causing cervical cancer. Therefore, if you have other strains, some women clear by themselves. It's the ones that don't clear that will develop into cervical cancer. Because we don't know who amongst us, it could be either of the women that is walking around that could have the invasive. We're saying every woman needs to take that call of screening. He's talked about lifestyle and smoking. We notice quite a number of young ladies nowadays, especially in urban settings, consider smoking to be hip. And consider it to be, I'm lighting up, I'm all cool, I'm all empowered, and all those things that we consider. I want to tell girls, yes, it could be hip to you, but consider what it's doing to your body. Not just lung cancer, we're talking about cervical cancer. We're talking about if you're young and you're discovered too late when it's already invasive, you're losing your uterus, you're losing your chance of getting babies. Right there, you've affected much more than you thought, even procreation, okay? So let people think about their lifestyle. Let them think about walking, for example, obesity. And this, again, I keep saying.
What link does that have to cancer, in terms of lifestyle and obesity when you say that?
It has been shown that the body weight predisposition to cervical cancer is higher in women who have a higher body mass weight.
Index, yeah.
Now, I'm not able to comment on that because I'm not a fitness expert. One thing I know is if it's something that would expose you to cervical cancer, do something about it. And I keep saying it's not about waiting to go to the gym or saying I can't afford that, or getting on a weight loss program or a yo-yo diet, which 1 minute I've lost, another minute I've gone back to it. It's about lifestyle changes. Walk more. Do something. Don't wait until you're saying, until I can afford a gym, that's when I'll go to start losing my weight. I can tell you, Sophie, walking works. And that is why for us as Women for Cancer, in September, we have a walk to say that not only are we calling on you women to do the September thing, it's walk 10,000 steps a day towards your health. Then come walk with us on 27th of September at the Globathon to save a woman, because any money that we raise towards the Globathon will be to give women free pap smears.
Well said, well said. You wanted to make a comment?
Yeah, I would like just also to comment on the fact that the bigger cervical cancer picture should not be left to women alone, and should not just be left to civil society in terms of creating awareness. Like their group is doing some small event, and there have been a lot of work by
it's
small
not
groups.
small. That is big.
I like
I'm saying it's a big event. No. It's a big event, but look at it in the context of the bigger cancer picture.
Yes.
You know, they're one group that is doing something, and we have 40.
It's everyone pulling their weights.
Exactly.
That's the thing.
So I'm looking at it. We have 45 million Kenyans. We have 40,000 new cancer cases every year, and out of those, we lose almost 33,000. So look at it in terms of the bigger picture. And what I was just driving at is that there's need for a national program that will empower. This is one well-meaning event that a civil society group is undertaking. But what about the women in Rokichogio, and what about the women in Namanga or Webuye or all those places? So there is need really to just accelerate. There have been a lot of talk, a lot of papers have been developed, but need to develop, to implement a national strategy. The implementation strategies are there, so that when a girl is growing up, they just know, just like we know all babies must have vaccinations. You know, it's just
they need to know to do the
they
screening.
know, we know at this age I'll need to do a screening.
Yeah.
You know, we just need to have that sort of system, so we are not having to hammer it.
Yeah.
So this is something that can be integrated even in the education system. Girls in high school, in colleges, so they just know it's part of their learning.
Yeah.
And that way we are able to create demand, because doing one event is a good thing, and
It's
this
good,
is an awesome initiative.
Yeah.
But then we need to call Kenyans, be part of Globathon, but take charge of that and call on our good government or governments in the various counties. You know,
Yes.
the buck stops with you. The buck must stop somewhere.
Okay, your final comments, Benda, because and more details perhaps on the Globathon, and maybe you'll give us information towards the date as well, so we can remind our viewers. So you say it will be a walk to collect money, and that money will go to offering free PAPs.
Yes.
Where will you be offering this? What will be the criteria on who gets to benefit?
Okay, Sophie, as Women for Cancer, when we started, we said that we want to make sure that every woman sees the need and also has the access, easy access to cervical cancer screening. Sees the need is awareness creation. We use all our events and activities and even opportunities that we get, and I want to thank KTN for this opportunity, that we are here talking about this so that everybody knows it's your prerogative to be aware of the benefits. Then we do events that are towards raising money. In Feb this year, we did a golf day, raised $1 million. Out of that, last week we were in Sigona screening women. We did 230 PAP screens, free of charge to women within the Sigona area. And this, we take it from screening, which is creating the awareness for the need, getting the women to come to the center. We give a medical camp in partnership with various stakeholders so that we are netting the woman. As David was saying, don't just get the woman to come and do the PAP screen only, because very few will come. Get women to bring their children for a medical camp, get women to come for a check on something, get her to bring the husband for something, and meanwhile also get a woman to PAP. So when we do that, then we further it with having that pap smear test read, the information, the results given back to the lady, and then we facilitate for the people who have been discovered to get treatment.
So where will you be giving this, this next month?
We do, like next month, we're targeting Athi River. After that, we have rolled out a program, and that's why I'm glad David said something to do with just one event. It's not just one event. We are looking at changing the policy around access to cervical cancer screening. We're looking at having that easy access, being able to be in very many counties, the 47 counties if possible. And if the corporate society would come on board with us, the government would come on board with us, we're targeting 1 million women in 4 years. That means for us that we can't just do the medical camp only. We also will be partnering facilities, medical facilities that are already in existence, so that we give them the facilitation for PAP kits.
We'll end it
Globathon
there.
is just one event, and it's on the 27th of September We will be working at Karura Forest.
Yeah.
We will be raising money, and the registration fee is only 1,000 shillings.
Have you opened registration?
Yes, we have opened registration.
Where do people pay?
We'll be having even online with our M-Pesa pay bill number 984110. Yeah, we are having various centers. We'll be having narcomats on board, various pharmacies on board, because we're telling women, just go register.
It's
Give
just
a woman
registration, be
a
part of it, and you're giving a woman a pap smear for free.
For free.
Thank you, Benda
Yes.
Kithaka, Chairperson Women for Cancer, David Makumi, who's Chairman, Kenya Network of Cancer Organization. It's good, and we applaud you for being a man who can talk about these issues. Because I think, as you said,
Very
it's that
true.
inclusivity that everyone
Yes.
has an understanding that
Yes.
will get us to move the conversation to the next level.
Correct.
And for everyone watching, if you're a woman, take it upon yourself, if you have daughters, to take them, or sisters, to advise or take them for this screening. Very important. It is something that can be caught early to avoid disastrous futures. So, as you've heard from our guest this morning, there are very many benefits to ensuring that that is done. And indeed, there is so much time to be able to do the screening early. We thank you for watching today. Have a lovely day.